Good evening, friends. Today, let me tell you something about an interesting topic. Which topic interests the general public much more? Yes, about sex. Sexual topics, anything pertaining to sex, does arouse interest, especially in the younger population. You may be wondering as to how a doctor so openly can speak about sexual matters. Let me remind you that Section 292 of Indian Penal Code punishes persons who uh, write or exhibit vulgar objects, vulgar papers, vulgar pamphlets, obscene objects, or if they talk something which arouses an our sexual desire, it's called as lascivious in nature. This is a punishable offense as per IPC 292. And what the punishment? If it is a second offense, people can be punished up to imprisonment up to 5 years and a fine up to 5,000 rupees. I can always say that I have got freedom of speech, freedom of expression as enshrined in our constitution. But freedom of speech and expression is there. It is there coupled with reasonable restrictions. Anyway, that is something about the legal aspects. I'm dwelling on a scientific topic. It's not lascivious in nature, it's not obscene in nature. By and large, sex is a pleasurable experience to both males as well as females. Unfortunately, God forbid, in some individuals, people have what's called as a painful sexual intercourse. In which sex it occurs more commonly? In females. Not that it doesn't affect the male population, but in the females, the incidence rises to a whooping 30%. 30% of the individuals, I mean, of the females, have at one time or the other experienced a painful sexual intercourse. It is called as dyspareunia in medical terms. Oh, what are the psychological implications of dyspareunia? Why does it occur at all? Can it occur as a psychological consequence? Yes. Patients or persons who are severely anxious or who are severely depressed, they can have painful sexual intercourse. Also, relationship problems. If there is a relationship problem between the husband and the wife or between spouses, it can cause dyspareunia. Painful intercourse is called as dyspareunia, as I told you. Stress can make the muscles of the pelvic floor of the female to contract vigorously, and that induces severe pain when she indulges in a sexual intercourse. History of sexual abuse. We have seen females who have come to us with history of painful sexual intercourse. And when we did an analysis, a psychoanalysis, we could realize that the persons have had sexual abuse during their early childhood or during their adolescence. That trauma, that emotional trauma, now is making that poor girl to suffer from a painful sexual intercourse, emotional distress, lack of intimacy between spouses, as I told you, can lead to a very severe painful sexual intercourse. There are some people who keep on avoiding sexual activity for days together, for weeks together, for months together. Reasons can be varied, reasons can be many. I'm not going to delve on that point, but avoidance of sexual activity for a long length of time, it can cause the individuals to lose interest. It can cause relationship problems, and such couples, when they try to experiment or indulge in a sexual intercourse, it can lead to painful sexual intercourse for the female counterpart. This is about the emotional aspects. There are some people who have got severe psychological disturbances like schizophrenia, wherein there is apathy, there is loss of interest, there is an emotional blunting. Such individuals also can sometimes have dyspareunia or a painful sexual intercourse. This is about the emotional aspects. Emotions do play A paramount role, a very important role in the causation in the development of such sort of a painful sexual intercourse. Are there any medical conditions which can cause a painful sexual intercourse for the female? Yes, there are many. Vaginismus. What do you mean by vaginismus? The muscles of the pelvic floor, the muscles of the outer part of vagina, they become tightened, they become contracted. And this leads to almost an impossible penetration of the penis, and this can lead to a very severe painful sexual intercourse also. Yeast infections in the females, they are notorious to cause dyspareunia. We have people who attain menopause, they complain of vaginal dryness, postmenopausal vaginal dryness, very, very common factor for painful sexual intercourse amongst females. You have a gynecological disorder, very commonly found, of course. Which one is that? Endometriosis. Endometriosis is notorious to produce once again a painful sexual intercourse. Treatments are there, no need to worry at all. Your gynecologist will certainly help you to undo all these conditions. Vaginitis, inflammation of the vagina, it can cause. There are some people who have undergone operations on the lower third of the abdomen, operations on the vagina, etc., vaginal hysterectomy, etc., post-operative scars that also can produce severe painful sexual intercourse. Are these disorders only confined to females? No. The stronger sex, the stronger sex means I am referring to the male population. Males also can have certain disorders which can produce a painful sexual intercourse. What are these? Inflammation, infection of the prostate, prostatitis, urethritis, infection of the urethra. We have penile rashes from various causes that also can lead to painful sexual intercourse. Peyronie's disease. What happens in this? The penis becomes curved, and due to that, persons are not in a position to enjoy proper sexual intercourse at all. The penis becomes curved due to buildup of scar tissues. So these are some of the conditions, medical conditions, as well as psychological distresses, emotional conditions, which can cause a painful sexual intercourse. People who have this dyspareunia, they can go to a gynecologist, they can go to a psychiatrist also. Psychiatrist will treat if there is an emotional aspect in this disorder, and gynecologist will treat the females if there are any gynecological causes for this painful sexual intercourse. Remember that certain psychiatric medications can also cause painful sexual intercourse. Which ones are there? Thyroidazine. It used to come earlier as a Melaril. Now perhaps it's not being used much in the psychiatric fraternity. Thyroidism can cause painful sexual intercourse. Antidepressants also sometimes can cause painful sexual intercourse. No need to worry at all. There are enough remedial measures available in the therapeutic armamentarium of a psychiatrist and in that of a gynecologist. Don't you worry at all. Every problem has got a solution. Please do seek the help of your consultants. Thanks a lot for watching. All the best. God bless you. Please do share the video.